Hi, my name is Dr. Pecoraro. I'm a chiropractor in Scotch Plains, New Jersey. And in this video I wanted to show you what I call a cervical disc pump. It's pretty good if people have a PI in the cervicals, especially if there's a swollen disc under it. So you know, take the main things that I tell you and adjust it to your own self and your own technique. This is something that I've basically, over the years, developed myself. It's similar to a Cox technique, but you don't need the table. Now, let's say this is the patient and they're facing this way. And normally what I would have them do is, if they can, flex their head forward as far as they can get. And then I would take this portion of my hand, point two, try to get it in between the spinous processes and under the spinous process of the bone that I'm working on. Then with the other hand on the forehead of the patient, you would put pressure sort of in this direction. As the patient, you have the patient bring their head back. Now, they'll do it to their own tolerance as far as the pain goes, but the stronger they do it, the better. Sometimes this is a little too sore for them, and so you might have to go kind of light, but you do it back and forth a number of times in order to pump the disc and move the vertebra forward. Now you can also use this same technique in the lumbar spine. You do the same thing. The patient is facing this way, let's say, and you have them lean forward. They're sitting, but they bend forward as far as they can. You try to get your hand underneath the spinous process that you're working on, and then you have them lean back against it. Now, both these techniques can also be done with your, let's say, with the patient facing away from you. For me, that would be this way. And then I would take my thumbs in the lumbar spine and put them underneath the spinous process, both together. So I'd be sitting here like this and having them come back against it. The same technique in the cervical spine I would do, again with the patient facing away from me, only this time I would have my thumbs on the lamina of the vertebra of the bone that I'm working with, let's say this one. And the same thing again. Have them bend their head forward as far as they can, and then as I put pressure on the lamina, they come back against my fingers to their tolerance. So I hope you'll be able to use these techniques. Again, it works in the lumbars or the cervicals for PI, posterior inferior vertebrae, especially if they're on the discs. You know, jammed down on the disc, and I call it a disc pump, so you can call it whatever you want and adapt it to your own techniques. So I hope it'll be helpful, and thanks for watching.